Is it a sprain or a broken bone? Insider Dr. Luis Rodriguez tells us what we need to know about fractures. Let's watch. Let's take a look at some of the symptoms that might result from an acute fracture. First, we have the pain. That's the first thing you're going to feel. So is the pain usually localized to where the fracture is? Or,
yeah.
Okay.
Yeah, there can be some radiation, but normally, your pain receptors are going to be telling you, hey, there's something going on right here. And so the pain tends to be localized with some radiation, but that radiation is usually contiguous to the area where the injury is.
And a big one is that loss of function or that mobility. Sometimes when you hit yourself so hard, you feel you may have broken a bone and you say, I can't move my arm, but is the first test the movement? Yeah,
if you can, because sometimes the thing is that you cannot. Even if you try to move it, you cannot move that arm. Then that should definitely tell you there's something going on there. The swelling may be a bit of a later sign. You may not see so much swelling initially. But if you do see swelling immediately, right after the injury, that should also raise suspicion for a possible fracture.
Do you have all these symptoms at the same time?
No, absolutely not.
No.
You can have one or many, depending on the site of injury, depending on the severity of the injury. So I do think a high index of suspicion is key.
Okay. Can fractures sometimes be mistaken for something else? Because there's even some individuals who might break a bone and might not even know it.
Absolutely, or vice versa. You may be sure that you broke that bone and turns out it's a ligament injury, because ligaments can also cause a lot of swelling and a lot of pain. So let's say you have a twisting mechanism to your ankle, and you may think that the bone is broken because you have so much pain and swelling, but ligament injuries can also do that. And tendon and muscle injuries will bleed a lot as well, cause a lot of swelling. Yes, correct. So yeah, there are other things that can mimic the symptoms of a fracture.
That's interesting.
So, but when you do see the severity of the symptoms be enough that it's causing dysfunction, pain, I think it's always safer to go get it checked out by a doctor.
Absolutely. Now, according to the American Academy of Pediatrics, hundreds of thousands of children were injured on slides in the U.S. from 2002 through 2015, and many of those injuries were fractures caused by sliding with an adult, which I had no idea this could happen. Let's hear why this happens.
Ready? This is the wrong way to go down a slide, and here's why. According to new findings presented to American pediatricians, riding a slide on a parent's lap increases the risk of injury to the child.
Basically injuring and fracturing their lower leg.
Dr. Stephen Maher is an emergency medicine specialist.
And with the parent's weight behind them, it actually causes increased force on the foot and ankle and causes fractures at that point.
According to researchers, of kids under 6 years old, toddlers ages 12 to 23 months had the highest percentage of injuries. The most common injury was a fracture, usually resulting from the lower leg being twisted or bent backward while sliding. Dr. Maher's advice is to monitor kids closely, but let them slide solo.
They're more flexible and they have less weight and therefore less likely to have a fracture.
Now that video only makes me think about how many times I've gone down a slide with my two and never once thought about that.
Yeah.
And it's so common.
Yeah, it is. And if you think about the mechanism, it can happen to kids by themselves when they're riding on that slide or sliding down that slope because of the way the foot is positioned on the slide. So essentially you're sliding down and then the foot hits the slide and then it's kind of like almost like trying to brake yourself or hit the brakes. But then as you're going down, especially if you have the parent's weight behind you, a much bigger body, then that can lead to an injury to the lower extremity.
That's more pressure. Okay, so then that leads me to my other park question, jumping off the swing.
Yeah. Same thing, right? I mean, if you jump high enough, it can result to too much. It can result in too much force applied or directed towards that bone and result in a fracture.
Now you have made me the least fun parent in the park because there's no more jumping on the swing, no more going down slides. Okay, so red flags that parents should be on the lookout for if they think that maybe their child may need to go to the ER or not because they have an injury.
Yes, and it can be difficult because some of these children at these ages cannot tell you how much or where it hurts. So one of the things to look out for, of course, any swelling, any deformity, but also if the child is refusing to put weight on the affected extremity. Let's say if it's a lower extremity, they're refusing to put weight on it. You see that they were very happy running around the park, all of a sudden they don't want to run anymore, right? Or they don't want to play anymore. If it's an upper extremity, refusing to grab things with that hand or to use that hand, these can be things that can give us that tip, that suspicion that there may be something going on.
Okay, thank you, doctor. And I want to talk about the different types of scans that are used to identify these fractures. So what's the first one you would say?
The most common one would be a plain radiograph or an X-ray, what people know as an X-ray. It's definitely very good at looking at bones. And, of course, when it's something so obvious as you see on the screen, then the diagnosis is that much easier. However, not every fracture, not every injury is going to be that obvious, especially acutely in the first hours to days after that fracture. Sometimes you don't even see it on the X-ray.
Really?
So it's important, yes. So it's important if you have that suspicion, protect the area and consider repeating that X-ray in a week to 10 days. And sometimes I've seen X-rays that look completely normal when I first see the patient, and then sure enough, repeat that X-ray in 7 days and you have a fracture.
So you would tell that patient to come back in?
Absolutely, absolutely. And if you really have that high of a suspicion, you may want to consider another type of advanced imaging study like a CT scan or an MRI.
Okay, and again, this is the same thing for adults and children? It can happen in both?
Yes, pretty similar. I think for children, the important distinction to make there is the growth plate. Because if you look at a growth plate, it looks like a fracture.
Right.
It looks like a transverse fracture. So yes, if you have that high index of suspicion, treat as if it's broken. I think that's a rule of thumb. When in doubt, treat it as if it's broken. Consider repeating that radiograph in 1 week. Or in many cases, consider doing the MRI. The MRI is going to show you if there's any area of bone marrow edema. The bone marrow is the substance within the bone. And if you see that on the MRI, then you know there's something going on there.
And Dr. Rodriguez also talked about how to prevent fractures in the elderly. So be sure to check out that info on the Health Channel website.